Director of Community Health at Robert Wood Johnson University Hospital, Somerset, and I am pleased to welcome you to today's webinar offered in collaboration with Friends Health Connection. Flu and cold season is here. Today we are going to learn how individuals become sick, the importance of hand hygiene and flu vaccination, and the best foods to eat to boost our immune system and help us stay healthy. We are joined today by Sharon Parrillo, a registered nurse who is the Assistant Director of Infection Prevention at Robert Wood Johnson University Hospital, Somerset, and Tia Hagins, a registered dietitian who is the Community Nutritionist, also at Robert Wood Johnson University Hospital, Somerset. Welcome, ladies, to both of you. We will begin our webinar with about 20 minutes of a moderated discussion, and then we will open it up to questions from our audience. So let's first start. I'd like to ask each of you to tell us a little bit more about yourselves and the role you play here at Robert Wood Johnson University Hospital, Somerset. So Sharon, why don't you start us off?
Sure. Thanks so much for having me. Again, my name is Sharon Parrillo. I'm the Assistant Director for Infection Prevention here at Robert Wood Somerset. I've been here about 9 years. And infection preventionists play a unique role in the hospital setting. They're professionals who make sure that healthcare workers and patients are doing everything that they can possible to help prevent the spread of infection and prevent the spread of disease. We look at patterns of infection within the facility, we observe practices, we educate healthcare teams, and we advise hospital leaders and other professionals. We also compile data, we develop policies and procedures, and we coordinate with local and national public health agencies and do a lot of reporting through that avenue.
Wow, thank you. And Tia?
Okay, thank you for having me. Like Serena said, my name's Tia Hagins. I'm the community nutritionist here. I'll be here, I just turned 17 years, and doctors actually refer their clients to me from the community for individual nutrition counseling in the areas of stuff like weight management, cardiovascular diseases, GI diseases, and to improve overall health, basically.
Very good. Well, welcome again, both of you. So Sharon, let's start with you. Maybe you can explain what causes us to get sick. Like, how is the cold and flu transmitted from person to person?
Sure. There are many different germs inside and outside of the healthcare setting, certainly, and they spread in different ways. They can spread from person to person, can spread from objects to people, so hard surfaces, high-touch items that are touched by multiple folks can then spread germs from one person to the next without actually having any contact with the individual directly. It takes a chain of events to spread infection to others, but people can spread flu up to about 6 feet away, and most experts feel that the flu virus is spread mainly by droplets when people cough, sneeze, talk, and if you happen to be in that airspace, it is then breathed in through the mouth and noses of people who are nearby and then inhaled into the lungs as well. Less often, flu can be transmitted through touching a surface or object that has a flu virus on it and then touching their mouth, nose, or eyes.
Oh, wow. So what can people do to prevent getting sick?
Certainly the one thing you want to do is avoid contact with people if possible. You know, sometimes that's challenging, especially if you have people in the home, but certainly do your best to keep a safe distance. Certainly get your flu shot. That's one thing that we all can do, and wash our hands often. You want to do your best to also avoid touching your eyes, nose, and mouth, as germs can be ingested into the body this way. It's just a good general practice to avoid touching the face, especially during high flu season and cold season. Clean items, commonly touched items such as doorknobs, door handles, remote controls, handrails, anything in the home that's a commonly touched or commonly shared item. If someone is ill, you want to make sure you're cleaning those surfaces often as well to help prevent spread of disease.
Okay, so you mentioned washing hands and that we should wash them often. So how often should we wash our hands? And is there like a best method of washing hands?
Sure. So keeping our hands clean is one of the most important steps that we can take to avoid getting sick and also prevent the spread of disease to others. It's important to wash your hands before you're preparing food. before you're eating, before and after caring for someone who's sick, after using the restroom, after blowing your nose, coughing, or sneezing. Soap and water is preferred. However, soap and water is not always readily available, so we want to make sure that we're using an alcohol-based hand sanitizer. And the recommendation is to make sure that that hand sanitizer has at least 60% alcohol.
Now, one of the things is how long should you wash your hands? Because I know, especially children, they go like this, they go like this and then they're done. So is there a time frame, like do you sing happy birthday, or what is that time that you should be washing your hands to get those germs off?
Yeah, the recommendation is generally 15 to 20 seconds. It's longer than you think, right? So counting out loud can help. Singing to yourself. I know you and I both have small children who share a space actually during the day, which is kind of fun. But I do stand over him and we sing a song. Generally, it's Happy Birthday twice, or you can certainly pick a song that they like and sing along with them, but make sure that they're standing there and actually scrubbing for that amount of time, because the scrub really is the most important part of the hand wash. When you're washing your hands, we're generally not killing anything that's on our hands. Most soaps don't have an antimicrobial component, but you want to make sure that you're scrubbing and lifting up the organisms off of your hands so that they ride on the soap bubbles and then get rinsed away. So the scrub really is the most important part of that process.
Okay. So conversely, with soap, you have hand sanitizer. So is hand sanitizer as effective as soap and water?
Hand sanitizer, the alcohol-based sanitizers can inactivate many types of germs very effectively when used correctly. However, they don't eliminate all germs. So soap and water certainly is the best method. But again, both need to be done carefully. If you're washing with soap and water and you're only applying the soap and rinsing and you're not doing a good scrub, that may not be the best effective method. And also with the hand sanitizer, sometimes folks don't apply enough product, so they don't get the full coverage on their hands that they need. The sanitizer really needs to cover all surfaces of the hands in order to make sure that it's coming in contact with the germs on the hands in order to kill it effectively.
Now,
you want to make sure that you leave the product on and allow it to dry.
Okay, thank you. Is there a difference in hand sanitizers if you use a lotion versus a wipe? And is one more effective than the other?
That's an interesting question. So there are some hand sanitizer wipes that are available. I think with kids, that probably is very effective. It's much easier to use. But generally, they each contain the same alcohol content. So if used appropriately, I don't see any real difference in the alcohol gel or foam versus the alcohol impregnated wipe that you may find.
Okay, great. So now with flu season, the big question everybody has on their mind is, when should you get a flu shot? And who should get it?
Yeah. So the CDC, which is Centers for Disease Control, recommends that all individuals 6 months in age and older receive a flu vaccine. You generally want to get a flu vaccine before flu begins spreading throughout the community. I can tell you that in the state of New Jersey, about 3/4 of the state is at moderate activity. So the time is now. Time actually may have passed a bit, but it's not too late to still get your flu shot. Generally, it's recommended to get the flu shot before the end of October, but getting vaccinated later can also still be beneficial. So if you've not received your flu vaccine, it's not too late. You can still get it, and there are many places that have it available. If you're not able to get to your doctor's office, Walgreens and some of the pharmacy spaces, Walmart even, I've seen signs, where they have flu shots available. So it is very readily available.
Okay, thank you. How effective, there's a lot of discussion about the effectiveness of a flu shot. So how effective is this year's flu vaccination?
Yeah, so the jury is still out about this year, but generally, each year studies are conducted to determine how well the flu vaccine protects against illness. And recent studies show that it's generally prevents about 40 to 60% of overall illness among the general population when the flu vaccine is well matched to the what is circulating in the community. So certainly we've seen years past where it's been not necessarily as effective, but we don't have any real data this year. The flu season is just ramping up. But overall, the CDC reports it's generally between 40 and 60% effective in what they've been seeing in past years.
Okay, wonderful. So Tia, we've been talking a lot about flu, a lot about hand hygiene. Let's switch gears and talk about some foods. What foods should we eat to actually help support our immune system?
Well, not surprisingly, a lot of the foods that you want to eat is going to be for general overall good health. So fruits and vegetables. More specifically would be fruits and vegetables that are high in vitamin C. Vitamin C has been shown to increase your production of white blood cells, which will fight the infection. So that's going to be stuff like your citrus fruits. So your clementines, your grapefruits, lemons, limes, oranges, tangerines. Some of the other ones are papayas and kiwis are also very high. It might be surprising to a lot of people, but red bell peppers actually have twice as much vitamin C as any of those citrus fruits that I just named. So that's always a good thing to have. Broccoli has been known to be very good because it's a good source of vitamin C, also vitamin A, vitamin E, which are all good to decrease your risk of infection. Garlic, because due to the heavy concentration of sulfur-containing compounds, which also decrease your symptoms and stuff like that. Ginger may help with inflammation. So spinach, which again is an antioxidant, which has been known to decrease inflammation, help with not just regular common colds, but also cancer and heart disease and stuff like that. Yogurt with the live digestive enzymes can help. Almonds are going to be a good source of your vitamin E and your omega-3 fats, so that's going to be something that's going to be good also. And green tea is actually one of the highest things with flavonoids, which is again another antioxidant, which would be helpful.
Okay. Well, conversely, is there any foods we should avoid?
Well, in general, again, the same as with general overall health, you want to avoid added sugars. For the first time with this year's, with 2020, the dietary guidelines, they realized that added sugars actually have more risk of producing heart disease and illnesses than actual fat, which is what they thought for a long time. So you really want to try to avoid added sugars. So that's going to be your white refined carbohydrates as well as your sugar beverages, your donuts and stuff like that. And you don't necessarily need to avoid them, but it's a matter, because all foods can fit. It's a matter of trying to get the right balance and proportion of foods. And then alcohol also has known to decrease your immune function and your general overall health. So you do want to try to limit alcohol, which is especially important during the holiday season.
Okay. So is it true that you should feed a cold? You know that old saying, feed a cold, starve a fever?
What is true actually is that you should really try to stay hydrated in both situations. So as far as obviously any nutrition is going to be good for you, but the most important thing is to stay hydrated, especially if you are, you're going to want to drink less during the times when you have a fever or cold. So you want to try to make sure that you're drinking as much as you possibly can. And that's going to be generally water. You can go to some electrolyte balanced formulas if you are vomiting or have diarrhea or something like that, but you don't necessarily need that. Water is going to be enough. You just want to try to make sure that you stay hydrated. As far as whether or not you're probably going to be less hungry when you have either a cold or a fever, but you'd want to try to get some nutrients in you because again, it's going to be important, but the most important thing is to stay hydrated.
Good to know. What about chicken soup? Does that really help?
Chicken soup does help, believe it or not.
It does help. How does it help?
It helps because it will improve your symptoms, and will also prevent you from getting a cold to begin with. And it also helps limiting the symptoms, so it thins your mucus, which is going to make you feel a lot better. So it doesn't necessarily decrease the length of a cold, but it improves your symptoms. And you've had a cold, so improving your symptoms is going to be a positive thing.
So that decrease of mucus you were talking about, is that due to the heat or the nutrients found in the soup?
Well, there are studies that show that chicken soup is more effective than actual just hot water. So it's going to be to some of the nutrients. It could be the bone broth in it. It could be some of the vitamin B6 that's in it. So although hot beverages will thin the mucus as it is, chicken soup is actually more effective.
Oh, very interesting. Did not know that about chicken noodle soup.
Grandmothers everywhere would agree.
Yes.
Yes. So now we'd like to open up questions too from our audience. And again, for those of you who have just joined us, you're welcome to post any questions in the chat section of the webinar. We'll be happy to take those questions, answer any of those that you may have. So one of the things I know, Sharon, that kind of comes up, if I could just interject, was on the, going back to the flu shot. Many people say they're apprehensive about getting the flu shot because they feel they get sick from it. Is that a myth, or is there some reality to that?
Certainly a myth. Flu shot does not make you sick. However, keep in mind the flu shot only will protect against flu strains. It does not protect against colds and other common illnesses that are circulating throughout this season. So keep that in mind. You know, if you take a flu shot and a couple weeks later you're sick with a cold, it's not intended for that, and it will have no immunity against cold viruses. And as we know, many cold viruses also circulate at this time of year. So I think that, yes, people still get sick after they take a flu shot, but it only protects against the flu strains that are protected in that flu vaccine, and it does not protect against any common cold viruses, which are generally circulating at this time also.
Okay. Now, different audiences, like doctors may recommend a quad or a tri vaccination. Can you explain which community members should get which vaccinations? Whether an older adult, for example, should get a quad versus a tri. What is the common recommendation there?
So there are some, CDC makes several recommendations, and you should certainly check with your provider before you make any decisions about flu vaccine, and also check with CDC based on your current situation. But they do make a quad vaccine, and they also make a high dose vaccine as well, and that generally is given to people over age 65. And also some facilities for folks that work in healthcare, they may also decide to give the quad vaccine, and high dose sometimes for certain specialized groups of individuals with certain illnesses. Their doctor may recommend that you get a high dose as well. But again, it's very important to check with your provider, see what's being offered, and see what works best for you, and based on what's going on clinically with you at that time.
So what is the true recipe, if you will, for preventing colds or disease? Is it the combination of diet and preventative vaccinations? You hear from people all the time saying, oh, I never get sick. I take vitamins, I do this, I do that, and they never get sick. What is that recipe? I don't know who would like to take that one.
I think it's a combination.
I believe it's a combination also.
I don't think there's one magic bullet. Believe me, if there was, I'd sell it and retire. But there is not a magic bullet. Again, avoiding people that are sick, which is tough sometimes. Handwashing is really so important. And as Tia said, getting the nutrients.
Staying hydration, getting sleep, just taking care of yourself. It's all. There's no all or none. It's everything.
Okay. I'd agree.
So one of our first questions from our audience is, how do you encourage children to take advice on hand washing?
How do I encourage children, or how should everyone encourage children?
It's
a hard stop in my house. It's a hard stop. No one gets to the dinner table without washing their hands. But I'm sure that'll get tougher as you get older. My son's only 2.5. Make it fun. We make it fun. We make it a fun thing. Allow them to participate as much as they can. If they're small, allow them to do what they can. My son likes to do the pump himself. He barely gets any soap on his hands, but then I come along and I quick squirt a little extra soap, but he feels that he's done it himself. Just engage them, explain why it's so important, and make it a hard stop. I'd make it a hard stop. I think that's the best way to do it, and it kind of, the practice becomes ingrained, that before we eat or before we have a snack, we have to wash our hands. So
you're very lucky.
That's my best way.
You're lucky. Mine actually pours too much soap on his hands, and then I'm there for a quite long time making sure.
Hey, that's not so bad.
So what else can you tell your kids to do to avoid germs, especially in school?
Oh gosh, the kids are notorious for touching their face. I mean, it's really tough, I think, in school situations. There's so many high touch areas, desks and books and toys and things like that. And if one person is not feeling well, it really can spread very quickly. My son's too small to really understand, don't touch your face. He's only 2.5. But as kids get older, important just to explain to them, how disease is transmitted. Explain to them that there's things on our hands that we can't see. And when we take our hands and we rub our eye or we put them in our mouth or in our nose, we swallow those bugs, right? And they make us sick. So as kids get older, it becomes, I think, a little bit easier for them to understand. But it becomes habitual. If you really thought about how many times a day you touched your face, it's very subconscious. And I think for kids too, they're just not thinking about that. They're playing, they're having a good time.
Yeah, what about coughing? What about coughing with the kids?
Certainly you want to
coughing, and then what do you tell your kids about coughing, and then what do you tell your kids about another child who is coughing?
Yeah, I know. Well, I tell my son to cough in his elbow. It's about 50% of the time at this point. He's so little. Usually he coughs right in my face, directly into my eye. But as they get older, they can learn more about coughing into the elbow, making sure that they're doing their best to keep their germs in their own space. Also sneezing, after they've used tissues, to wash their hands or use alcohol hand sanitizer to decrease the spread. But kids are busy. They're on the go. They are not thinking about these things. So it's really our job to just continue to remind them and be that little voice in the background.
Yeah. Well, how about for the holidays? What can we do to spread to prevent the spread of virus or avoid getting sick while we're visiting with family and friends? What do you recommend for that? Well, we know Tia's don't drink.
Too,
Tia, you're
I think it's going to be, and I also think that it's important to, again, it's the same thing. It's just heightened. So it's, make sure you wash your hands, make sure you're doing what you're supposed to as far as food preparation. Don't leave the food out for 4 hours. Some of this goes into other things than just the common cold, but it's everything around. Make sure everybody's washing their hands. Try to get everybody to, if they're sneezing, to cover their nose and their elbow. If they're coughing, the same thing. Wash their hands after they're done with that. Try to incorporate more fruits and vegetables over the holidays.
And I think sometimes it's harder in the holidays because the holidays are coming, right? Thanksgiving comes whether you're sick or not, and it's hard. You don't want to miss the holidays. But if someone is sick, make a plate for them. Maybe encourage them not to touch every single thing in the line. If you have a buffet set up, maybe say, hey, can I make a plate for you? You're not feeling well. Why don't you go sit down and relax, and maybe make a plate of all the things that they would like, so that they don't then touch every single thing. There's some little things you can do. That I put the hand sanitizer out when I host at my house. I encourage it. Not everybody uses it, but make it available. But I think for folks that aren't feeling well, maybe make a plate for them. It's just a simple thing you can do, and makes them feel special too. So that's nice.
Okay, Serena froze, so I'm going to just pose the next question here until she comes back. What if you are flying to see family? What can you do to avoid getting sick on an airplane?
Wow, that's tough.
The airplane. Yeah, there's lots of interesting studies that are coming out talking about, contamination at airports. Certainly we've seen the studies about the bins that you put all of your items in, as you're going through security. I will say that those bins have found to be the dirtiest item you'll find at the airport, because think about how many people touch that just in an hour, and it never gets cleaned, never gets looked at. So, when you go through the security line, use your hand sanitizer afterwards. Bring a little sanitizer with you. You're allowed to bring products 3 ounces and under, right? So keep it with you. I always bring it with me when I fly. I also bring a little packet of sanitizing wipes, and I will wipe down the little armrest on the plane and the seatbelt buckle and the little tray table in front of me. I'm that person on the plane, but you know what? That stuff doesn't really get cleaned very often. So it's just a simple way to do your best to prevent the spread of infection while you're flying. There's a lot of people coming through the airports, and I would say hand washing is your friend for sure.
Okay. And I think that's probably the same type of tips you would give to somebody in a public bathroom, correct?
Oh, yes, you absolutely want to wash your hands. Be surprised, the toilet seat is probably the cleanest thing you'll find in an airport. You know, a lot of people are hesitant about toilet seats, but my motto has always been to sit. You know, the toilet seat is fine. The tray, the bin at the security counter where you're checking in is absolutely disgusting. So just keep a reference of that, and whatever you touch, just know that thousands of people have touched it before you, and wash your hands or use the sanitizer. You'll be okay.
So this is a very interesting question. How often should we clean our cell phone?
Well, it's tough to say. I don't really have any hard studies on how often we should be doing it, but certainly it can become a very heavily contaminated item. You know, I clean mine at the end of every week, at the end of every work week on a Friday. I'll clean my cell phone. I don't really have any hard data on how often we should be doing that. Certainly you want to use a product that's safe for your phone. You don't want to damage it in any way, and so check the manufacturer recommendation on that first. Okay.
Well, with a lot of people traveling too, what should people do when they're staying in hotel rooms? What type of germs should they watch out for? I mean, you mentioned a lot of things that I think are applicable to any public facility, but hotel rooms also can present another barrage of issues. So maybe you can address that a little bit.
I think it's the same, very similar. Any high touch surface, can be contaminated. I think hotels do their best, to clean space and clean rooms. I know when I travel, first thing I go for in a hotel room is the remote control for the TV and the doorknobs and the phone. I take my wipes, I just wipe them down. It's really easy. It's something simple that you can do. Those are high touch areas, and wash your hands often.
Excellent. Someone told this participant that not to hold the handrails of escalators because they're never cleaned. So what are your thoughts or recommendations on that?
I agree, they're probably rarely cleaned. I think it's a risk-benefit situation. If you're unsteady, please hold the handrail. You don't want to take a tumble down an escalator. But if it's something that you're very concerned about, use your hand sanitizer after you're done with the handrails, especially now that everybody's out and about shopping. Keep a small hand sanitizer in your purse or in your pocket or in your jacket pocket while you're running around and making your errands. But again, if you can stand on the escalator safely without holding it, I think that would be fine. But you want to be really careful with that if you're unsteady, to make sure you're holding that handrail and then washing your hands after.
This next audience member is asking about humidifiers. What do you think about them? What role do they play in both prevention and why you have in treatment of a cold or illness? And is there a specific brand you might recommend?
Well, I certainly don't have any specific brands that I recommend, but humidifiers are shown to help help folks sleep, especially in the nighttime when they're having a cold or congestion. It just helps to moisturize, the mucous membranes. I don't have any real recommendation on a specific humidifier. It is important to clean the humidifiers, to keep that in mind. If you have a humidifier in a room and it's had water in it for a prolonged period of time, any type of stagnant water can grow bacteria or mold, and then if you're aerosolizing that could be problematic. So you want to make sure you're changing that water frequently, especially read the instructions on the box and follow that.
So what do you think about putting Vicks into a humidifier? And what do you think about the use of Vicks in general you know, especially when somebody's got a cold or congested, you know, a lot of people use that type of a product to help them breathe a little bit better.
It certainly is helpful. I know for my son, I use it. You know, if he's not feeling well, I'll put the Vicks. But I do have a special Vicks humidifier that allows for that product to be used. Again, you want to check with manufacturer recommendation. They're not all compatible. So you check on that, and also check with your healthcare provider to make sure that Vicks is appropriate for any children in the home. I know that sometimes for young infants, it's not recommended. So you really want to check with your pediatrician and healthcare provider on that. I do use it for my son. I do feel that it is somewhat beneficial, helps them to sleep a little bit better at night.
Okay. Now, one of our participants is a teacher and wants to know, as a teacher, what can he or she do to stay healthy?
Well, God bless you. God bless you for caring for our kids all day. It's hard on teachers. You know, they've got a lot of kids to deal with all at one time. And again, if you're teaching very small kids, they will come right up to you and cough and sneeze right in your face. You know, so my heart goes out to you. It's tough. You know, I would expect the unexpected. You know, be prepared for the sneeze or the cough. But, you know, wipe surfaces down, clean the surfaces, any high touch areas, any toys. If the kids are working on a project together, you know, encourage them to wash their hands. You know, that's really all you can do. Recognizing when kids are really sick, I think that's so important too. You know, sometimes, you know, a child can look perfectly well in the morning, and then as the day goes on, they're really not feeling well, and, you know, calling the parents and making sure they're coming to get them. So any sick kids really should stay home to help just prevent that transmission of disease. So you really are a key point in that disease recognition. It's so important to just keep an eye and recognize when someone, you know, may need to be excused for the day.
So, and probably I'm thinking the rules of staying well also apply, right? To eating healthy, making sure
Of course.
Sleep, diet, exercise, hydration. You know, that
Absolutely.
also plays a factor in a teacher's ability to stay well. So this is an interesting question. Where do you think the line is between protecting yourself and becoming a germaphobe? A germaphobe. I think, like,
I don't know what you're talking about.
Germaphobe.
There's no line in my book.
Well, the most famous germaphobe that I think is known is Howie Mandel, right? Howie Mandel is known for not wanting to shake anybody's hand. So what do you think, where do you draw the line between protecting yourself and becoming a germaphobe? Is there a way to still be friendly, greet somebody, but, or do you just make this?
I think you have to work with the comfort levels of each other. You know, if someone doesn't want to shake hands, I'm perfectly fine with that. I'm happy to give them a fist bump or an elbow bump, or you know, I think this stigma around that really has just been so loosened that if folks don't shake hands, yeah, you can give an elbow, give a fist bump. Yeah, I mean, you know, it's personal preference. It's you know, please don't coop yourself up in your home, you know, and not leave and not interact. But I just think that it's personal preference. I'm not sure there really is a true line of you know, prevention and germophobia. I think it's whatever works for you.
So do you feel that people with jobs that have a high exposure to germs, like your teachers, healthcare professionals, do we tend to build up higher immunity than other professions that aren't exposed to as many germs?
I'm not so sure about that. I've not seen any studies on that personally. But certainly, you know, teachers, healthcare workers, you know, we're exposed to a lot of different things, and generally you do build up immunity over time. You know, you won't get the same exact cold virus twice, but unfortunately there's hundreds of cold viruses that you can still get. So yeah, I'm not sure that they're any more better off or worse off.
All right. Well, I want to thank you both. I think that, we just got, hold on. I was just about to thank you, but we just got in one more question. So let me take this question real quickly. it's a food related question. So Tia, is there anything we can eat or drink now, like you mentioned the green tea, that is known to help keep us healthy or boost the immune system? So is there anything besides the green tea?
Besides green tea?
I guess, yeah.
Green tea will help. Green tea helps much more than black tea, because black tea is fermented, and in the fermenting process, it takes away the flavonoids. So, so that's going to be something that, again, that's why the green tea is something that's more recommended. If you, again, the more that you can get from food itself, the better off you're going to be. But if you're not someone that's going to eat the fruits and vegetables, take a multivitamin. You know, it's not necessarily food or a beverage itself, but you can do stuff like that. As far as energy drinks are concerned, I would not recommend doing one of those, because it's going to give you a false sense of security as opposed to actually helping. So again, try to get your fruits, your vegetables, your omega-3 fats, you know, your sleep, stay hydrated, and that's really what I would recommend doing.
Now, is there a drink or a snack that we can give our kids that would also help boost their immunity or their immune system?
No, I would go with water to make sure they stay hydrated. And I mean, you could do a green iced tea for children. What'd you say?
I'm sorry, what about an orange juice? Because you had mentioned all the vitamin C's. So
you're better off eating the orange than drinking the juice. Okay. There's a lot more vitamins and minerals in the fruit itself than the juice. As far as what's recommended for juice for children, it's no more than 6 ounces a day, because it is still loaded with sugar. And orange juice, even unless you squeeze it at home yourself, still has added sugar to it. So then it goes into that, are you actually helping or are you hurting? Because now you're adding the sugars to it. So better off actually eating the fruit than drinking the juice.
That's a very good tip. Thank you so much.
Thank you.
We don't want those kids with that extra sugar. We send them to your house then. Well, thank you both very, very much. Thank you to our audience. This concludes today's webinar. We want to thank you all for joining us. Please remember that the opinions shared here today by our medical experts are not a substitute for medical advice from your actual physician. If you do need a physician, please call 1-888-MD-RWJ-UH. For more information about Robert Wood Johnson University Hospital Somerset, please visit www.rwjbh.org/Somerset. Thanks again and have a great day.